remember with sterile gloves, you pick the glove up, turn your hand upside down, and pull this down. Then what I do when I'm doing sterile gloves is I stick my hand up underneath there so I've got good control of this other glove, and I stick, and if it messes up, that's fine. Both my hands are sterile, so I can pull this down. You don't want to grab the edge right here, okay? So I've got my dressing, I've got tape and everything. Then these are my 4x4s. And I'm just going to wet a couple of them, so you put those down in your solution. The inside of your tray is sterile, so you can touch them. So you take your swabs and you clean on the inside first. You want to do inside out. So you want to clean down in there, and whatever's ordered. So you want to clean the area. Okay, then you take, and you don't want these sopping wet, but you want them to stay moist. So you can, kind of wring them out a little bit, and then I kind of stretch them out. And lay them in there, and you can use your big, and you want to kind of push it in the wound bed. You want to make sure your wound bed is completely covered with this moist dressing so that granulation tissue can happen. So really, I would do another one on here. Then you take your, it's called an ABD pad. Remember, the blue stripe is on the outside. This is just to catches extra drainage. So you would lay that down, and then, as always, tape it down and date, time, and initial on a piece of tape or your dressing that you did, so that everybody knows when the last time the dressing was changed. Especially if it's just once a day and you're not going to be on duty the next day. They need to know when the dressing is changed. Or if it's changed more than once a day and it's just once a shift and it's a 12-hour